You've decided you're ready to become a parent, and suddenly you're overwhelmed with people who feel they have the right to inform you on the correct way to conceive, give birth, what fears you should have, and the proper way to parent. How do you filter through the opinions? How do you know what's trustworthy information and what's a myth or just plain outdated? Welcome to the Birth Ease podcast. Join your host Michelle Smith and her guests as they cut through the noise and fear by sharing valuable tips, tools, and proven methods that help you connect with your own inner wisdom as you navigate the sacred journey that is pregnancy, birth, and parenthood in a more relaxed and confident manner. This podcast does not constitute, nor is it intended, as medical advice.
Hello, Birth Ease families. Welcome to your reprieve from the noise and the stress that can often accompany pregnancy, birth, and parenthood. I'm your host, Michelle Smith. In today's episode, I am very excited to have with me Juliet Michaels, chiropractic physician. We are going to be discussing the benefits of chiropractic care during pregnancy, birth, postpartum, and for newborns. Juliet earned her Bachelor's of Science in Chemistry from Northern Arizona University and her Doctorate of Chiropractic from Palmer College of Chiropractic. She has published research on the benefits of chiropractic care and its efficacy of many pediatric and pregnancy-related issues. Juliet is very passionate about helping Central Florida families achieve their pregnancy, birth, postpartum, and neonatal goals. Thank you so much, Juliet, for being here with me today.
Thanks for having me.
So, can you share with the listeners what drew you to chiropractic care, because you are so passionate about that?
I knew from a young age that I wanted to be in healthcare, but I wasn't quite sure what. And I explored many options for a really long time. Chiropractic was always right up there in the top 3 or so, but it wasn't until my sister chose to do chiropractic throughout her pregnancy and have a chiropractor come adjust her in labor and then adjust the baby shortly thereafter that I didn't realize you could do that with chiropractic. And I was thrilled to find that out, and I was immediately sold. Yes, sign me up. Let's do this. It just seemed so powerful and impactful. And it was very inspiring, and ever since I've been in love.
I love that story. And it's always nice when it's someone close to us that inspires us to do what we love. Can you share with us what the benefits are in pregnancy? Because in my experience working with families, I know the benefits, I see it. However, sometimes families are a bit reticent to receive chiropractic care because of the myths surrounding it.
Okay, so first of all, let me say that every chiropractor is trained to deal with pregnancy and pediatrics. However, there are a smaller group of us who find a passion for it and have taken more credit hours to learn about pregnancy and pediatrics and how to deal with that correctly. So, although you may be able to find care with any chiropractor, you might be more comfortable when you're just starting out finding a chiropractor trained in pediatrics and pregnancy like myself. There's quite a few of us here in Central Florida, and we're all very good resources to find each other. Or you can go to the ICPA4kids.org, and that's the number 4, or ICPA4kids.com, and type in find a chiropractor. You put in your zip code and choose the radius from your house, and it will give you a list of the chiropractors who are certified in Webster technique, which we'll get to in a little bit, and also who have gone through the certification, who have learned more about pregnancy and pediatrics. So some of the benefits that you might experience throughout your pregnancy really varies greatly from person to person. However, most of my patients say that they feel less pain. It's very common for you to get sciatic pain during pregnancy, low back pain, upper back and neck pain, headaches, rib pain, foot pain. And so, of course, all those aches and pains are greatly alleviated or can go away completely. But also, patients tell me that they feel like they're functioning a lot better. They'll get less insomnia. They'll be able to think more clearly, digest their food more easily. Constipation or GERD-like reflux, something like that will go away. So there are quite a few benefits, and they'll vary greatly from person to person, even pregnancy to pregnancy.
So in my experience, I've also noticed that women that receive chiropractic care during pregnancy tend to have easier labors. There's less instances of a baby being malpositioned. When I'm working with clients, I recommend chiropractic care so that they can have a more comfortable and easier pregnancy like you were discussing. But I also feel like it really helps them to prepare for labor and to help prevent a baby that's malpositioned. If the baby's facing the mom's spine during labor, that's the position we want, but sometimes babies have their back against mom's back, and it can make for a longer, more uncomfortable labor. And working with chiropractic, I've seen the way that you and other chiropractors can help get the baby into the optimal position that can move a baby that's what we call OP, meaning the back of the baby's head, the occiput is against the mom's spine. And you can get that baby to move, or even you can turn breech babies, which is amazing. And it always saddens me when moms feel like that they have to schedule a cesarean birth and they haven't explored the options. Acupuncture can help, spinning babies can help, but I feel like the biggest go-to is chiropractic and Webster's technique. So can you, I know that's a whole bunch, but can you address that? Because it's so powerful. When I have women say, I'm seeing a chiropractor in pregnancy, I think, yes.
Yes, absolutely. So that's one of the things that made me fall in love with chiropractic, is that one of the powerful moments is you get to be there while this baby is being created and this birth is happening, right? And if the mom does have to go into a C-section because the baby is breached, then how is that going to affect her for every other pregnancy that she has down the road? How is that going to affect this baby because the baby isn't being squeezed through the birth canal? How is that going to affect their bonding experience afterwards and the trauma that she might feel? So going back to that other question that you had earlier about what it was that got me into chiropractic, that's one of the things I love about it, is that right here at the beginning, it's very powerful. Going into the Webster technique, however, I think that's a common misconception, is that the chiropractor is actually turning the baby, but we don't do that. Just to clarify, that is something that the OBGYN would do in extreme circumstances, but the chiropractor doesn't ever push on the baby to turn the baby. All the chiropractor does is work on balancing the joints and muscles of the pelvis and the abdomen. So primarily the round ligament and the sacrum. It's very common for a pregnant woman to have one joint be more fixated, like lock up a little bit more than the other. So that would cause the sacrum to tilt one way or the other. You might feel that your pubic bone is sore or tender, and it could come from some position that you're holding very commonly, maybe for work or when you're relaxing. You might sit on your foot, for example. Or it may come from the baby being in one position. So often we'll get a baby whose back is on your left side, and most of the baby's weight is putting more pressure on your left side of your pelvis, and that can tilt it out of place as well. So what the chiropractor does is evaluate those joints. Are they all moving? Do they all feel symmetrical? And we have different tests to go through to determine that. And then we'd also put our hands on your abdomen underneath your belly button and above your pubic bone to feel for your round ligaments. And you might feel round ligament pain during your pregnancy as well. And so some of you will be really familiar about where that round ligament is, and you could tell me exactly where it hurts. But we'd put some gentle pressure on that as well to make sure that those are balanced. Because if one round ligament is tighter than the other, it's going to pull that uterus to the side. It's going to kind of twist it in a way. And that can affect the baby's position, not only in labor, but as it's developing. And so what happens with these women who are unbalanced, shall we say, you'll find that their babies are in a position that isn't beneficial to them at that period of their pregnancy. For example, you'll have a woman who's 38 weeks pregnant and her baby is still breech or oblique or transverse. And that could be one of the reasons is because the joints are misaligned or her muscles are tighter on one side versus the other. So that's what the chiropractor does. We come in and we work on that. And very often I'll get my patients calling me from the parking lot, even saying, oh my goodness, I feel all this movement. Then they'll go get checked by their OBGYN. And hey, sure enough, the baby's head down and putting plenty of pressure on their cervix, and they're ready to go, and they're going to avoid that C-section. So I wouldn't say that chiropractors move babies. All we do is balance the body, balance the joints and the soft tissues, and the body does the work.
That makes sense. I feel like you free up the space for the
Right.
baby to do what it needs to do to turn head down.
Right. So that's called Webster technique. And you can find chiropractors who are certified in this technique by going to that website I mentioned earlier.
It can also help at the end of pregnancy to get a baby lower in the pelvis, right?
Yes.
So can you explain that much better than I can?
Sure. Well, it mostly goes back to that round ligament issue. So if the round ligament is tighter on one side than the other, it's almost like pulling a blanket across your bed and it misshaping the blanket. So the baby won't be able to push down into the pelvic outlet because there's too much tension on that lower part of the uterus and the beginning of the cervix. Also, with the pelvic outlet, the shape of the actual hole that the baby's going to be passing through can be significantly altered based on the alignment of the joints. If your pelvis is twisted a little bit, then you can see how it would change the shape of the hole the baby's going through. So it would be more difficult for the baby to get their head and shoulders through, causing the labor to be longer, maybe more painful, and certainly just more of a trial than it needs to be if you had gotten it addressed.
Well, and it makes sense to me that if a pelvis is crooked or off, or earlier I was saying wonky, which isn't the best word, but the pelvis is off, but the baby is in a good position, but the baby can't enter into the pelvis properly because the pelvis is misaligned.
Right, and then another point that I want to make about what's so wonderful about what chiropractic does is when we're working with those joints are there protecting the nerves, and some of these nerves innervate the uterus. And don't forget, that's what this is all about. At the end of the day, during the birth, we want that uterus to contract. And if there's any pressure on the nerve, even the weight of a dime, we know that it cuts the nerve's function in half.
Wow.
So there is some nerve signal coming through to the uterus, for example, but it's just like a traffic jam. The information is going through to the uterus saying contract, but maybe not as efficiently or effectively as it should be. And so if we can free up that pressure off of the nerve by doing these adjustments and this muscle balancing, then those contractions can be more powerful and be more productive, so that the mom only has to experience a few of them compared to many more hours of them to get the same amount of work done. And then with the alignment, getting the baby down in the right space before labor, and also allowing that space to be as big as possible so that the baby can get through as easily as possible. Those two things together make a very powerful combination. And statistically, women who get adjusted throughout pregnancy and during labor have faster and what they report as easier births than those who don't.
That's amazing. Like I said, I've seen the results. Years ago, I had a couple, the father was a chiropractor. She was in labor and she was kind of doing a little bit of prodromal labor. The midwife and I were chatting and trying to think of ways for her to help facilitate that labor and get it moving. And as we were chatting, I said, he's a chiropractor. And they were still at home. So we suggested that he adjust her, and he did. And 2 hours later, she walked into the hospital 6 to 7 centimeters.
Yes.
And it made all the difference. Or another labor, they were doing a home birth, and he's a chiropractor, and he was adjusting her in labor. And it made such a difference in the effectiveness of the contractions. It shortened the labor. It was really incredible, in my opinion.
Absolutely.
One of the dads that's a chiropractic physician as well, he was talking about that if those ligaments are too tight on one side, the round ligaments, that it can even pull the uterus to the side, and it can affect where the placement is of the cervix on the baby's head, and then the head would not be well applied. Have you found that to be a concern as well?
Absolutely. So depending on how those round ligaments are pulled or the position of the baby when the baby comes out, you'll have some babies whose chins are tucked correctly down to their chest. and they'll come out almost crown area first. And then you'll have other babies who come out with their chin far away from their chest, and they come out almost with their forehead or their hairline coming out first. And that can be painful for the mom, depending on what alignment the baby is. Is the baby facing her back or her tummy or her side when this is happening? But also it can greatly affect the baby's spine as they're squeezing through the birth canal. So that's one of the things that I ask about whenever I'm treating a newborn is, what was the baby's position at birth? Not only did the baby come out feet first or head first or butt first, or did they come out C-section? But also, was their chin tucked, or was their hand up by their face? Because that can change the alignment in their neck. If their hand is on their cheek, which is a common thing to have happen, it can throw their jaw out of alignment or just irritate the joint. And then that misalignment and having your chin up can affect your neck, and then therefore affect how that baby will nurse in the first few days. And that not only is difficult for their nutrition, but it's really difficult for the bonding period. That's really important those first few days. It can put a lot of stress, especially on a first-time mother who thinks that maybe it's her fault that nursing is so difficult, when really it's maybe just the infant is having a little trouble with their TMJ or a little trouble with their neck because they were a little bit misaligned during birth. So these adjustments that we do during pregnancy can be really powerful throughout life, because we're talking about nutrition and bonding. And is this child drinking breast milk, or is this child using formula? And then this might affect the woman's perspective on her second pregnancy. Does she even choose to do a second pregnancy because it was so difficult on her the first time around?
And what you're saying, I can really relate to it, because my firstborn was born with forceps. And she still suffers with headaches, and she'll be 34 years old in a few months. And she's done chiropractic care as an adult, but I didn't know. And my baby cried and cried and cried when she was first born, and I think she was in pain. Mm-hmm. And I know too, sometimes working with moms, that a baby will only want to nurse on one side.
Right.
And sometimes it's what's going on with the nipple, and they prefer a certain nipple, but sometimes it hurts for them to nurse on that other side, and they'll fuss and they don't want to take the breast, but it's because something is misaligned and they hurt. Or my last baby, her jaw was really, really tight, and it made it painful for her to nurse. And when I took her to the chiropractic physician, she took one look at her and said, you would know what muscle or ligament it was, but I don't know. But she's like, this is too tight. And she rubbed on her jaw, and my baby's jaw relaxed, and nursing wasn't painful anymore. It was absolutely amazing. And I'm so grateful. And even helping her to feel less colicky, because she was a little colicky. Mm-hmm. And it made all the difference. And I feel badly. I didn't know with my first how her birth could really impact her that much.
Yeah, it's very powerful. Very powerful. So that's one thing that I'd like to talk about is when we adjust pregnant women and children, it's wildly different than it would be for somebody in a different life stage. And one of the wonderful things about chiropractic is that it's customizable. It's very easily customizable compared to other professions, where we're going to treat somebody who's pregnant more gently than we would a woman of the same age who isn't pregnant. We'd also adjust children very differently than we do adults. We're not going to be thrusting, popping, clicking, twisting your newborn infant. That's one of these common misconceptions that a lot of people are scared about bringing their infants to a chiropractor, because they might have heard some crazy tabloid or seen something that scared them, or heard something that scared them from a neighbor or something like that. But anybody who knows what they're doing would never thrust forcefully on an infant or twist their neck with a sharp twist. That wouldn't happen. And so I want to ease some of the listeners' fears about bringing a baby to a chiropractor who knows what they're doing and is comfortable, is completely safe, especially those who have been certified through the ICPA. we spend a great deal of hours learning how to do this and practicing this skill. We're pushing on the baby's joints with the same amount of pressure that you would push on a tomato, for example, in a grocery store to see if it's ripe, that little squeeze that you would give a tomato, or maybe the amount of pressure that you would put on your eyeball to scratch your eye. But it's not going to be a huge, all of my weight like it would be a 45-year-old man with low back pain,
Right.
So it's very different.
Right. And from when I've observed it, it's almost like you're holding gentle pressure.
Mm-hmm.
And the baby, for lack of better words, self-adjusts. And it's amazing to witness. I remember a few years ago, we were attending a birth together and the baby had been born. And the midwife would hold the baby tummy down and the baby would be fine, like across her hand. And then she flipped the baby over and held the baby on his back and the baby would scream. And then she did it again and put the baby across her hand on the belly and the baby stopped crying. Flipped the baby back onto his back and he would cry. And then you did the most gentle things with him. And then when the midwife did that again, the baby didn't cry either way. It was amazing to witness because you could tell that this baby was in distress.
Yeah. It's very common for the infants that I adjust to stay asleep throughout the adjustment or to go to sleep very quickly thereafter. I'll hear from the patient's parent, the moms will say, hey, the baby's sleeping through the night now. The baby is nursing and it doesn't hurt me anymore. The baby is able to nurse now and wasn't before. We were feeding the baby with a dropper, but now we can nurse. The baby is making bowel movements and clearing their meconium, or they're not constipated anymore. So yes, absolutely. It's a very gentle adjustment, especially for very young children and infants. And I don't want the listeners to get this picture in their head of a lot of force or clicking and popping and twisting. That's
or cracking. People say
right,
cracking.
Cracking. We're not cracking infants' necks. No, it's very, very gentle. It can sometimes just look like I'm cradling the infant or giving them a gentle massage. But it's very powerful, it's very specific, and it has a purpose. And so even though it doesn't look like much, it is doing a lot of work. You have to remember that babies' muscles are not used to holding up their heads and their bodies. They're not weight-bearing muscles yet. They're not very strong. And their bones themselves aren't completely calcified. They're mostly cartilage when they're born. And so therefore, it doesn't take a lot of pressure like it would an adult or an older child to gently push it back where it should go. It doesn't take a lot of coaxing. It doesn't take a lot of effort to make that happen with a newborn. It really doesn't have to be much more than just gentle pressure. And like I said, it might not look like much, but it is.
It's really amazing to witness. Years ago, my first experience in seeing a chiropractor work with a baby, I was the birth assistant in a birth center, and the baby's respirations just would not settle. And if we couldn't get them to settle, we were going to have to talk about transferring the baby to the hospital. And so we were looking at ways to help settle the baby and keeping an eye on it, and we would have transferred if we could not have gotten the respirations to settle down. And then someone mentioned that they were a chiropractic family, and they called their chiropractor, and this amazing man came in, I think it was 9 o'clock at night. He had that sweet baby girl on the bed. Like, I have goosebumps because this was such a powerful experience. And he gently cradled her little head in his hands. And he said, oh, she came through the birth canal like this, blah, blah, blah. And he was exactly right. And then he did that gentle pressure you're talking about. And the sweet girl's arms were contracted and up near her body. And he did that gentle pressure, something released. And this sweet girl took a big breath. And then with the next breath, her arms relaxed and her body relaxed, and her respirations went to exactly where we needed them to be. And again, I have goosebumps all over me. It was the most incredible thing I'd ever seen. And that's when I knew there is something to this chiropractic medicine, and the benefits are huge.
Yeah, absolutely. I would like to bring up how you know that your baby should go get checked.
Yes, please.
Because not necessarily the baby needs to be adjusted, but what is it that you should be looking for after the birth to see, okay, maybe I should find a chiropractor. Maybe I should bring her to the chiropractor I know and love to get looked at. So one thing you might notice is that your baby's head is tilted.
Yes.
And one way that I encourage my patients to look at that is not just in this one moment, but look at all these hundreds of photos that you have of your newborn baby on your phone. Do you always notice that her head is tilted to the right or to the left? Or maybe her head is rotated to the right or to the left a little bit more. But it very commonly will always be the same direction. Her head is always to the right. Her head is always rotated to the right. And so that is a big sign that, yes, she has that asymmetry and she could use some help with that. And that could be to do with the way that she came out of the birth canal or through the C-section. You might also notice that the baby is very colicky or just won't stop crying, or positionally so, like you were speaking about earlier, when the baby is on their back or on their tummy, they just hate that position. They cry and they won't stand for it. You might notice that the baby really dislikes getting their diaper changed, and part of that, not only because they're on their back, but having their knees up or
Oh, wow. Yeah.
putting pressure on their pelvis. It goes beyond, oh, the baby has a diaper rash. It's not that, because maybe this baby is too young to have a diaper rash even, but maybe their hips are misaligned even. Or the baby isn't sleeping well, and beyond what a newborn would not be sleeping well. The baby just never sleeps or always sleeps.
Oh.
So the length of time, the way that the baby nurses, like you were saying earlier, does the baby prefer one breast to the other? And of course, seeing a lactation consultant is very helpful to make sure that one nipple is not inverted or has an issue.
Yeah, or the baby doesn't have an issue with their latch,
Right,
that type of thing.
right,
Yeah.
to make sure that the baby doesn't have a tongue tie or a latch issue, but it could go into the baby's turning their head and it causes pain, or that the TMJ is locked up and causes pain. It could be one of the reasons that we're having trouble nursing. So really that's what I want to listen to from my patients is the baby eating well? Is the baby sleeping well? Is the baby passing bowel movements well? And do they look symmetrical? In my office when they're presenting, and also to you at home, because moms know their babies better than anyone. So have you noticed that the baby isn't moving correctly? And then we do this throughout the life stages. It's not just newborns who need help, right? It's babies who are just learning to pick their head up, babies who are sitting up for the first time. They're going to be putting pressure vertically on their spinal column for the first time. Babies who crawl, we need to make sure that they do that cross-crawl reflex correctly. That cross-crawl pattern, that motion correctly. We've all known babies who crawl with the funny crawl, with an incorrect crawl, and that could mean some kind of imbalance in their body that needs to be addressed. Babies who are learning to roll over for the first time or twisting their spine for the first time, and their spine hasn't learned that behavior before. So we need to make sure that that is balanced and correct. And then, of course, babies who are walking, right? One of the things that comes with walking is a ton of falling.
Right.
Falling on your tush and falling on your knees and hands, and that's going to throw things out of place because, of course, you're not falling symmetrically every time, right? And so I always encourage patients to bring in their babies at every life stage. Every time your baby learns one of these new tricks in the first year, that's a really great time to just come in for a check and let's make sure that everything is balanced. Let's make sure all those joints are moving correctly, the muscle tone is correct on both sides, and that there's nothing out of place to help the baby just thrive and develop the best that they can.
If something is off, too, can't it affect the way that they hold their body posture? And we'll always keep our eyes even on the horizon. So sometimes we turn our head to compensate and we don't even realize it, right? Am I explaining that right?
We talked about this a long time ago when we were talking about how powerful chiropractic is, especially during labor. So this goes back to when the baby is coming out of the birth canal. If the baby's head is tilted one way or the other, or if their chin is in the incorrect position, being that it's not tucked down to the chest, it's supposed to be tucked down to the chest, it can affect the way that the muscle tone of the baby's neck is held after the birth, right? Okay, so if this baby has a head tilt for a significant period of time after the birth, the bottom of the occiput, the bottom of the skull where it touches the neck, is made up of cartilage, which is very malleable. It's very pliable. And as that baby grows and develops, if they continue to have this head tilt forever after, that cartilage is slowly turning into hard bone. And the shape of that cartilage is now going to be modified because of that head tilt. It's going to be squished flatter on one side and up open more on the other. Does that make sense?
Yes.
Okay, so then it's going to change the shape of their skull for the rest of their life, really. And if you have a head tilt like that, it's going to change the way that you want to hold your eyes level so that you can see the world properly. And you always want to naturally keep your eyes level with the horizon. So what is that going to do to you as a child or an adult? You're going to be pulling on your neck muscles subconsciously to straighten out your head yourself. And what can that do to you over a lifetime, right? That can lead to not only problems like headaches, but maybe also arthritis as you get older.
Wow.
Neck pain. It can lead to issues where possibly the child doesn't want to tuck their chin down to their chest to study and learn. And how would that affect somebody throughout their life? It could be really powerful in a lot of different ways.
Like I said, for my older daughter, she was born with forceps, and when we finally did get her into a chiropractor, when we learned about chiropractic care, when they did the x-rays, he asked her if she was either a violinist or if she was born with forceps, because her neck was so off and we didn't know. I've done my best to let go of that mother guilt, right? She can't do what you don't know. But it affected the way that her spine developed or grew. Would that make sense?
Sure.
Yeah, and so she's always struggled with headaches, and they're a lot better now because she does do chiropractic care and she does ballet and exercise, and that's all really helped her strengthen her core. But she's also a tattoo artist, and so she has to sit in really funny positions a lot of times, and so that's part of why that chiropractic care is so important for her. I feel like because she does have that misalignment naturally, it's extra important for her to keep it in place, because then it'll even start making her hips hurt.
Absolutely.
Some chiropractors will come to your birth for a fee. I'm sure most of them would charge a fee, but they'll attend a birth and help to adjust a mom in labor, and that can be a really powerful experience.
Having a chiropractor in your labor is an excellent resource to have and an excellent partner to have in the room, because not only is it another set of hands to do hip squeezes, but this person is going to be constantly evaluating your joints and your muscles and your ligaments to make sure that they're continuously doing what they're supposed to be doing in whatever phase of birth that you're in. And then also having that chiropractor there for the first couple of hours after the labor, we're having them come back even the same day and taking a look at the baby. Like we said, getting the baby checked in the first couple of days is really important and really powerful, because it can greatly affect not only your quality of life and how easy nursing can be or changing diapers or sleeping, but also it can greatly affect how you're bonding and how you're experiencing becoming a parent to this child for those first few days. So having a chiropractor there is, for me, just incredibly powerful. I don't know how people do without it because it's so helpful.
I feel like it's really helpful as well for moms that have had a previous cesarean birth and they're wanting to do a vaginal birth after cesarean. And most of us doulas and childbirth educators, we are typically recommending it because we found that it just makes a difference to help make sure that her pelvis is open and to allow the baby to move through, because maybe with her first birth there were restrictions and the baby was malpositioned, and if we can help ensure that the baby is in a more optimal position, then it's going to help lead to that success more readily.
Sure. Also, the chiropractors who I know who are used to going to labors work really well with the rest of the birth team whenever you get a vaginal exam in labor. And the midwife or the OB tells the chiropractor, listen, the baby's in this position. And then you listen to the mom and she's saying, this is what I'm feeling. I feel pain here. I feel like I can't move here. And also the chiropractor ourselves doing the exam and feeling the position of the baby and feeling the joints and the muscles. We take all of that information. We listen to what should the baby be doing at this stage. Is the baby trying to get in the pelvis and can't? Is the baby in the part of the birth process where they're going to be rotating to try to get their shoulders under? And we use all of this information to help us perform the correct adjustment and also to help and say, you need to put your foot up here, you need to move this direction, you need to swing your hips, or you need to do XYZ. Having that chiropractor in that room, I can't speak highly enough about having chiropractic in labor because it's so beneficial. It makes it so much easier. And we work really well as a team with the other partners in the birth team.
Yeah, I agree. I've seen it when we've done births together. It's been really fun.
Yeah.
I help them to relax more deeply, and you help make sure everything is lined up, and we make position changes. It's really an incredible experience. But if you can't find a chiropractor to come to your labor, doing that work to see a chiropractor throughout your pregnancy, or if you're 38 weeks pregnant and you're just now learning about chiropractic, please don't hesitate to go in. Even if you get a couple of adjustments, it can make a big
difference.
Yes. Yeah. Or we had a mom once, she was just having this difficult labor. And when she was adjusted, the whole left side of her pelvis was all locked up. And then once that was released, then the baby was able to rotate. It was incredible.
I want to encourage you to check into getting yourself adjusted after the baby.
Yes.
Because one thing that moms, especially new moms, tend to do is start thinking only about the baby, and we kind of put ourselves on the back burner. But your body has been through a lot, and there is such a thing as a fourth trimester. So your body still has relaxin after the baby, but that's dwindling every day. You get less and less, and therefore your pelvis becomes less pliable. Your spine, all of the joints in your body become less and less pliable. So we have a limited window of time to kind of realign your pelvis back to where it should be. I've had some patients where, for example, their pubic bone was misaligned in labor because when the baby came through in the position that they did, it opened up their pubic bone and caused some irritation. Then they never sought treatment after the baby was born. And so it kind of fused back together, if you will. I mean, it's always fused, but it solidified back together in an irritating position, in an irritating way, and always caused them some pain. That really affected a lot of their life, the way that they could work and move throughout life and even their personal relationships. So when she sought care with me, we worked on it, we got some great results, and then thankfully she got pregnant again, and the relaxin hormone started making her pelvis even more pliable again. And so pregnancy is a unique moment in a woman's life to kind of work on her joints, that she's incredibly malleable. And also, if you know that you have scoliosis, this is a moment where you need to see a chiropractor, because scoliosis can shift and move greatly throughout pregnancy. And those curves can become more severe. But like I was saying, you have this relaxin hormone happening when you're pregnant, and so it's an opportunistic moment to try to straighten out those curves as much as you can during your pregnancy and fourth trimester. So please, after the birth, make sure when you bring the baby in to get checked, you get checked too, and make that time for yourself.
I think it's really important because our bodies go through a lot as we give birth.
Yeah.
And tailbones can get misaligned. There's so many things that can happen. But it's about 6 weeks that it's optimal, right? Or a little longer?
I've read research paper where it says 6 weeks and other people 6 months. So
okay.
It can be a bigger window. Yeah.
Oh, good. That's good to know.
Yeah.
That's good to know. While we were kind of talking about positioning, if a baby isn't wanting to stay in a best position because a mom's abdominal muscles aren't strong enough anymore because she's had multiple pregnancies, she can have diastasis in her abdomen. You were doing a technique to even help tape her belly, right?
Absolutely. Okay, so there's something called athletic tape. And there's many different brands of it. You might have heard it called K-tape or Rock tape are two of the biggest brands. But what athletes use it for is to almost make a malleable or flexible brace of sorts. It's very helpful whenever you have an extremity that's sprained, like an arm or a wrist or a foot or an ankle that's sprained. You can put this tape around it, or knee, and it helps to brace the area, give it support and strength, increase some circulation so that it can heal while it's still decreasing swelling in the area. But it allows you to continue to move those joints, which a brace would not. So one of the techniques that some of the chiropractors in the pregnancy and birthing world have come up with is that we put this athletic tape across your abdomen, almost in a shoelace pattern, to kind of cinch your abdominal muscles together to keep diastasis recti from happening to begin with or from getting worse. And I've had quite a bit of success with that. I've had some patients who have been diagnosed with severe diastasis recti, and throughout their pregnancy they were able to keep it at bay using this, and just some women who were on their third or fourth baby and it was just getting worse and worse, and hey, we want some more stability because the baby is moving around. The baby always wants to be transverse, but this tape kind of cinches everything together and keeps that baby in the correct position because she's almost ready for labor and that baby's got to be head down. So this can be really helpful as well. Asking your chiropractor about athletic tape or K-tape or Rock tape can be really powerful. So we don't only use the tape on the abdomen. It's fabulous for helping with swelling of the feet. Yes, depending on how you cut the tape, it can relieve swelling if you use very tiny finger-like strips of tape across your feet. And so I used to do this to myself when I was pregnant. It was fabulous. By the time I finished taping my right foot, my left foot wouldn't be swollen anymore. And it was fabulous because I had a big problem with that. We can also use tape to help with carpal tunnel symptoms. Of course, neck pain, low back pain. And I love to use that tape, not just for supporting the diastasis recti, but also to go underneath the abdomen to bring the baby up and in, to hold some of the weight of that baby, especially in late pregnancy when the baby is so big and can come out over the pelvis, maybe putting pressure on your pubic bone, causing a lot of discomfort. So tape, I think, is a really great resource to have with chiropractic in pregnancy.
I really love the idea of this because I've seen sometimes with women when they lose their abdominal strength, it's almost like their belly becomes pendulous. And I'm sorry, mamas, those of us that have lost our abdominal muscles, but the baby it will be too forward over the pubic bone and it makes and down. So it makes sense that if you can increase that core strength to help hold the baby into a better position with the tape, it really makes a difference. So anything else, any little pearl of wisdom that you want to share with mamas about anything in pregnancy and birth, because you have so much experience with it?
Okay, I would say don't be afraid of seeking out a chiropractor as a partner throughout your pregnancy, birth, fourth trimester, or even the year after you give birth, and to help with the baby. And don't be afraid to speak openly with that chiropractor about your hopes and fears for that relationship. And also don't be afraid to fire them. If you think that this is not the right space for you, move on, because one of the wonderful things about chiropractic is that we are all a little bit different. It's almost like a massage therapist. Our techniques are different, our touch is a little different. So I don't want one person's experience with one chiropractor to make them write off chiropractic for the rest of their lives. Please, please try again. Because this is such a powerful resource for you to have throughout your pregnancy and birth and that first year after postpartum, for your baby and for your life, every life stage. This can be fabulous. You just have to find the right person who you love and trust and form a lifelong relationship with. If you feel like you do not want to have a chiropractor at your birth, that's okay too. Going to the chiropractor throughout your pregnancy is very powerful. And of course, it's optimal to have them at your birth. But having that safe space for you is even more important in my book. You can always have the chiropractor come evaluate you before in the very early stages of labor, before you get naked, before you get in that birth tub, before you start moaning and groaning, right?
Right.
Before it gets too personal, right? Where you are in your zone. Have them come in the early stages and then kick them right out if you're not comfortable. And then say, please come back whenever we're done. Please come back in the first few hours. Please come back a day, the second day or the next day, and check on me and the baby and evaluate me and the baby. But it's a very powerful tool, and I don't want anybody to think, oh, I can't do that. I can't have somebody there in the birth with me and write it off completely, because we can be there at the beginning and at the end and not be too personal if that's what you're thinking.
Right. And I want to add that if a mom is having prolonged early labor, or the words prodromal labor are mentioned, then check with your chiropractor. See if you can get adjusted to help facilitate that labor. I've seen it make a huge, huge difference to do that instead of laboring for days and days and days.
Yes.
I don't want to act like chiropractic care is a panacea and can fix every single thing, but it is such a powerful, powerful tool. And I think it's important when women are pregnant, and especially if they're planning a natural birth or they're wanting to do that VBAP birth, having that knowledge that you know that you did everything you could to optimize your ability to get the birth that you dreamed of. I think it helps so that if maybe a mom needs a cesarean or a repeat cesarean, or maybe something else happens in her birth that maybe she was disappointed in, I feel like having that knowledge that you did everything you could is helpful. I know it's different for everyone, but okay, I put all the pieces in place to help me get a good birth.
Yeah, absolutely. But also working with the rest of the birth team. Like we were saying, a doula is so important. Having somebody there to maybe do acupuncture with you is so important. So there are a lot of resources that you can choose for your birth and pregnancy and for that first year postpartum. But I think just going to try it. Go visit with a chiropractor and see, do I trust this person? Do I feel safe with them? Do they feel knowledgeable? Do they feel comfortable getting an exam done? Evaluate me. Let's see what you find. Do you think there's a problem here? And if so, what can we do to address it? That would be where I would start.
So thank you so much for being here with me today, Juliet. If someone wanted to reach out to you, how could they find you?
I currently work part-time at Integrated Chiropractic in Winter Garden, just below the birthplace, Jenny Joseph's place.
Oh, wonderful.
And you can also look me up on Facebook at Family Tree Chiropractic or Juliet Michaels.
So thank you all for joining us. And just like Juliet said, remember that you know your baby better than anyone.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birtheaseservices.com/podcast. For more information on the Birthease method, Michelle's classes, meditations, and other services, go to birtheaseservices.com.